Namaskar. Welcome to Ahara Arogya Adhyatma, the light of Samskara. Today is the World Trauma Day. Trauma is not an ordinary thing. It can not only destroy the life and the health of that person who was traumatized, it traumatizes the whole family. Because the whole family is depending on the person, the breadwinner, and that is the one which is. We have none other than Dr. Balaji Pai, who's a neurosurgeon but also has done masters in the hospital. He is the so your trauma center has grown by leaps and bounds. And today, how many patients come to the OPD and what are the facilities that you have? Please tell us, sir. How many surgeries you are doing?
The first thing is that I'll start from the as the patient enters the hospital. What we can say, the emphasis for this center is on trauma. Of course, we do take a lot of emergency cases like poisoning and even stroke and all that. But the emphasis is on trauma. The moment the patient comes, there's a casualty with a resuscitation bay, everything there. Plus, we have all the investigations that are required, including 24 hours lab, 24 hours CT, 24 hours ultrasound, and as well as a 32 slice CT scan. Now we are also within 1 month, I can assure that MRI is also going to be installed and working. We also have probably the first in the country trauma care center to have a DSA cath lab too. So this will interest you very much as the cardiologist. And also we have our focus, we have a 36-bedded ICU. I'm glad to tell you that usually in a 36-bedded ICU, there would be around 20 ventilators. But I can vouch and say that in our 36-bedded ICU, we have 40 ventilators. That means 4 are standby.
I do agree, sir, because I myself have called you up for the ventilator bed, for the patient who could not afford the private hospital.
We have 4 major OTs, totally state of the art, as well as 3 minor OTs. For all, our focus has been on trauma for orthopedics, trauma for neurosurgery, neurotrauma, general surgical trauma, plastic surgical trauma, as well as some sometimes we also do spinal trauma also, all these cases. So we have about 120 general ward beds apart from these 36 ICU beds, and then another 25 beds in the casualty. So this makes it arguably the largest trauma care center in the country. And we cater to around 100 and about 50 is around 60 admissions per day. That means about 2,000 admissions per month and around 6,000 or 8,000 OPD patients per month. So far, if you calculate, we have treated lakhs since we have established.
I know. I can vouch on that because when a Swamiji sent a person with a brain tumor and the waiting list was so much and you immediately took over and then treated. And also you said that you have the cath lab. So in the cath lab, today radio, the therapy and also the angiogram for the brain as well as the other peripheral angiogram is very, very important. How it come that you have that facility also in your hospital?
I'm glad to say that this facility came thanks to our minister also with the support. And we are doing cardiological cases, we are doing interventional radiological cases and interventional neuroradiological cases. We are also putting together our system for even vascular surgery cases, peripheral vascular surgery. And all this, I'm glad to tell you that this was without any government funding. This was from our own kitty. This cath lab. And also, as I said, we have also inaugurated a 200-seater auditorium, which are named after my hero, Dr. Abdul Kalam.
Great. Very nice. So Abdul Kalam was, he became a missile man and you have become a trauma man. So being his ardent fan, so that is protecting the country and you are protecting the families from the tragedy of the trauma. And sir, you are doing such a yeoman service. And what is the cost difference compared to the private or other centers?
Yeah, this is very minimal. For example, our nominal, very minimal. And the ICU rate. I mean,
Mm.
if a person is there without a BPL card, with a BPL card, of course, it is free. If he
Mm.
is without a BPL card, the ICU rate per day is 2,000 rupees.
Oh,
Whereas you know outside
that
how
is
much it
nothing.
is.
It is cheaper than a hotel.
I should not have answered this because I'll be flooded now with even more patients.
No, no, but you'll be doing more surveys, and that way
Yeah.
your center also will grow, sir. So
More importantly,
yeah, you can expand. Yeah.
and also importantly, my karma meter will also grow.
Yeah, that is true.
I
That
can
is
see,
true. I fully agree with you.
I can
I
see,
fully
I
agree
can
with
see
you.
Adhyatma written in behind you.
Yes, sir. Yes, 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 yes. And you know, I remember you not only get the patients from Karnataka, even from the West Bengal and the North
Hmm.
India, because one of the child who came with the brain abscess, and you know that boy was cyanotic, and the saturation was so low, hardly
I remember
46,
it was
50
60 or something.
saturation.
It was 60 or something
Six
saturation.
6 years, yeah, yeah.
60.
And then you know I opened the pulmonary valve with the balloon, and the saturation improved, and then you treated that brain abscess patient.
Absolutely.
So now to cater in India, in Karnataka, have you got any other centers other than in Bangalore?
Yes, that's recognize the need for trauma. As I said, it is not only a patient killer, it's a family killer. And it's a national burden also. So we are trying to get a trauma care center in various districts. The first, apart from this, the one which I opened was in Gulbarga, which is doing exceedingly well. And they were not,
Okay,
in fact, I can say it is creating a much bigger ripples there because
okay,
there were no such centers anywhere around, whether it is
yes,
so that then Raichur has come up. We are in the process in
okay,
Chitradurga also. Mysore is
okay,
also
okay,
there. And
okay,
also we have been trying to get someone in Belgaum also. And Ballari
okay,
also.
great.
Ballari also.
Okay. So it is like our Jaydeva, no? Where, like
Yes.
how we have the branches in Mysore, Kalburgi, and Hubli and all. So you're also branching out. And that's really great because the heart attack also kills in the prime of the time, and the trauma also kills in prime of time. And you never know when it is going to come. It will be like hitting like the bolt in the blue. So you are coming as a savior and a great thing. And today, why it is called as the World Trauma Day, and what is the importance, and how do you want to respond for that?
The main reason, I mean, for us to give a thing is to create an awareness,
Okay.
as you are doing very well by this podcast or whatever.
Yeah.
Nowadays, the Gen Z wants to call it podcast or
Okay.
interview. So it is to create an awareness
Mm,
and to not only create an awareness, to create importance among
mm.
the policy makers as well as the
Okay.
policy implementers, the
Okay.
significance of trauma and its effects.
Mm. Okay, sir. So it is so nice talking to you, sir, that not only that you started a trauma center in the complex of Victoria Hospital, out of 3,500 beds, you know, you are occupying, and a very imposing building. It is not only the building is imposing, the work done there is very, very impressive. And I'm very much impressed by the work that you're doing. So God bless you. May your tribe increase, and may your service spread to more people in Karnataka. Thank you very much
Thank you,
for your
madam. It's a great
kindness,
honor.
sir. Thank you,
I
sir.
have a small message. I had made a small, I forgot to tell you, a documentary movie
Please tell.
on road traffic accident
Please.
prevention. Now, that is
Yes,
called
sir.
Jeeva Jagrati. I wish all your
Okay.
viewers would go and see this movie
Yes.
on the YouTube. It is available both in
Okay, sir.
Kannada and Hindi. So this is the
Okay,
in
sir.
Hindi. This is
Great.
Jeev Jagrati. In
Okay.
Kannada also it is Jeev Jagrati. It is available in
Okay, sir.
YouTube. I have created 10
Okay, sir.
chapters basically on how to prevent road traffic accidents because I've seen
Okay, great,
many
sir.
brainless actions and activity going on the road,
Yes, yes,
which
yes. Now,
stimulated me to make this
it is irresponsible people are causing the traffic thing.
traffic thing.
And
Very,
now
I
the
mean,
traffic has increased. And in fact, you know, somebody joked, you know, when a driver, see, I have driven the car for 40 years without any accident. So I can tell we have to be responsible for others'
Others'
irresponsibility.
mistakes, yes, very
Their,
correct. We
their
have to anticipate
irresponsibilities.
others' mistakes
Yeah,
and
we
take
must
corrective action.
anticipate. Yes, yes.
And
So
one
that,
more thing, for example, I'll give you, apart from the usual things like drunken driving and helmet with driving
uh,
with helmet and all
mm,
this, I've also dwelled in that documentary film on simple things. For example, which side of the road a pedestrian should walk on.
walk. Yes,
I've seen most of the pedestrians walking on the left side of the road. Wrong. They should
yes,
walk on the
yes.
right side so that they can see
Correct.
the oncoming traffic.
Traffic.
As well
Correct,
as
correct.
I've seen many mothers and parents carrying the children, taking the children on the side of the traffic
Yes.
rather than protecting them away from the
On
traffic.
the other side. Yes, 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 yes.
That is so, I mean, annoying and irritating. I find that, I
I
mean, it
know.
is
I
very,
know. Yes, sir. Sir.
so all this is put, even I've
Yes.
also early morning, I've seen people, these joggers. I agree, your jogging is good for health and all that, but they wear dark clothes and jog. So early in the morning, you cannot see them.
Yeah. So,
That
so,
is injurious to the health then. Then
so
the jogging is not good for the health.
yes, sir. Thank you. Thank you very much for
Thank you.
your timely advice and also masterly treatment that you're giving. Thank you very much, sir.
Thank you, madam. Thanks. It
Thank you.
was a
Thank
great
you.
pleasure and honor to be with you.
Thank you.
Thank you.
Thank you.